Now let's go to another issue. There's calls for end-of-life care to be made a government priority after it was found just one palliative medicine specialist is available for every 704 deaths each year.
Palliative Care Australia says that without a significant policy overhaul, tens of thousands of people will die without having their final wishes met. Their CEO, Liz Callaghan, joins us now from Canberra. Liz, many thanks for being there. Obviously, that 1 in 704 deaths is an average. So do we read from that while some areas have better support, there are others where the situation's even worse?
Yes, that's correct, Ali. So we have, with that figure, we have on average there's 0.9 FTE per 100,000 population of palliative medicine specialists, and that varies. So in Victoria, for example, there are 0.7 per 100,000 population, and in Tasmania up to 1.8 per 100,000 population. And really that variation is apparent in rural and regional areas. It's not a surprise. With all of our health services, rural, regional and remote areas do have a lesser workforce, but there are 181 palliative medicine specialists operating in major cities, and only the difference, sorry, it's about 9% operating in regional areas.
Liz, what does that mean for families? Take us through what a palliative care specialist can provide compared to normal medical care.
So palliative care specialists are part of a palliative care team. So they're just one aspect of what you can, I guess, access when you receive palliative care. So whilst they're important, they're not the main game. The main game is the multidisciplinary team. So they are part of that multidisciplinary team. And you can expect to receive impeccable care, actually, if you receive palliative care. Care that really manages your pain and symptoms, and care that also addresses your psychosocial and emotional needs. And palliative care as a philosophy of care looks after the whole family as well as the person. So if you were to receive palliative care, you will have, it will be very person-centred care and have your needs met and be very individualised.
And on your numbers, so many people missing out on the opportunity for that very specialised care. Does that, I suppose, I mean, perhaps not you because you work in the field, but it does seem to be a relatively alarming number, particularly given that access to quality palliative care has been such a strong argument against the legalisation of euthanasia in states like Victoria, for example.
Yes, and I think we need to look really closely at all of these issues, and that's why we're calling for a National Palliative Care Commissioner. We really need to look at the effectiveness and the efficiency of existing services, really understand who's missing out, and make some sort of assessment in terms of access. There is quite large discrepancies in terms of investment by states and territories into palliative care services. The Commonwealth Government has made a significant investment this financial year, but there are still people who miss out on services. So, for example, there are around 160,000 deaths per year, and of those, around 75% of those deaths could be expected. And so you would then, we argue, expect those deaths, and so those people would benefit from some input by palliative care, so looking after their psychosocial needs, their pain and symptom management. So at the moment there are only 40,000 people who receive specialist palliative care services per year, and there's 120,000 people who would benefit. And so that's quite a significant shortfall. Now, not everyone needs ongoing specialist palliative care services, and people can live for a very long time with their life-limiting illness, and they may only need a certain amount of care, but really we're calling for a much closer look at these issues and to really identify what the gaps are, and to ensure that wherever you live, you can get the care that you need.
Because there was one other quite alarming statistic, is that an extraordinary number of people wish to die at home, but in fact very few actually do.
Yes, and I mean, that's an interesting statistic, Ali, actually. That's something that we survey every year, and without fail, 70% of people say they would like to die at home, and the national statistic is 14%. However, that statistic needs to be qualified. We're asking people who are well where they would like to die. And so in the absence of having a life-limiting illness, it's very easy to say, I would like to die at home. So in practice, what we like to, I guess, promote is that people receive the care that they want at the right place and the right time. So I think last year's data from the Palliative Care Outcomes Collaboration showed that 75% of people who received care died in a hospital, and most of those people had a diagnosis of cancer. So it's really about ensuring what the individual wants, and that their needs are met, and that the health system can respond to what individuals and families are asking for.
All right. Well, look, thank you very much for talking to us about it this morning, and we'll await to see the federal government's response to that call for an inquiry into where those gaps are. Thanks for joining us.
Thanks so much, Ali.
Now let's move from the news desk over to the sport couch. It's over to you, Georgie.
Thank you very much, PK. Brisbane Heat captain Brendan McCullum has slammed a decision by the third umpire during their 3-run loss to the Hobart Hurricanes.